There have been several treatment options and methods for Bartholin cyst that have been proven to work. These methods actually differs. Some are home remedies where you have the advantage of treating yourself at home. Some are medical options where you have to go to your facility. Some options takes longer for you to get your relief than the other. There are just several of it. But oftentimes when you go to your medical facility or you speak to your doctor, they might be actually recommending that you go through the route of surgery. Yes, sometimes surgery might also be your last resort. So if you really want to know if you should opt for a surgical procedure or you wait it out or try some other options, if you're at that crossroad and you really need to make a decision, then this video is just for you. Ensure that you watch it from the beginning to the end so that you can make the best decision for yourself. Let's dive right into it. So when should you consider surgery as treatment option for Bartholin cyst? Number one, it is when your gynecologist is not sure if what you are actually dealing with is a Bartholin cyst. Maybe your gynae is starting to have doubts, maybe because of the result of some previous tests that you have run or some diagnostic procedures that you have had to go through while you have this episode, or how your symptom is actually progressing and your gynecologist is beginning to have a doubt and is not really sure if what you are dealing with is a Bartholin cyst or there are probability that it could be as a result of a more serious underlying condition, then I would really advise that you stick with your gynae and allow him to do his job. Take it out and probably go for further testing. The second reason why you might want to consider having a surgical procedure as a treatment option for your Bartholin cyst, the characteristics of your cyst is unknown or it is not clear. Normally, your Bartholin cyst is supposed to be soft. It's supposed to pop on its own over time. It's a cyst. It's supposed to pop on its own over time and all. But if the cyst is now taking longer, you've had this cyst for maybe some 12 months, it's taking longer, it's hard, that is, it's firm to touch, it's excruciatingly painful and all, then you might really want to consider a surgery, especially if the cyst is not popping on its own for a very long time. The third reason why you might want to consider a surgical procedure to treat your Bartholin cyst is if you are pregnant, you are in your third trimester, and you are considering vaginal births. 3 things: pregnant, third trimester, considering vaginal births. If you are close to delivery, you have a cyst that is not popping on its own, and you really want to have a vaginal birth, then you might really want to consider having a surgical procedure to take it out so that the wound or the incisions being made can heal up before your labor starts, and also so that you prevent infecting your baby, provided there's an infection going on down there, or in case there's an infection, it also saves your baby from getting infection while passing through the birth canal. So I would really encourage or persuade you to look at surgical option like maybe masurpialization or something if you really want to consider vaginal births and you are close to delivery. The fourth reason is if you continue to have continuous episode of horrible Bartholin cyst. It is not going away. It keeps coming back. You've tried so many options and it keeps coming back and it's horrible. Then you might want to consider complete removal of that Bartholin gland, just so that you can have some peace, so that you can rest. You might really want to consider removing the gland, taking it out totally, so that you don't keep having this episode. And number 5, the fifth reason is if you have tried every other solution and it is not working. my dear lady, you might have to consider surgery to take it out. You have tried home remedy, it's not popping. You have tried watchful waiting for it to pop on its own, nothing is happening. You have tried several methods and they are not working out. Then you might really want to consider surgery to take it out. So under those 5 conditions, I would really advise, suggest, and also agree with your gynae that maybe surgically removing the cyst or even the Bartholin gland might be the best option for you. In all, I really wish that you are healthy. I really wish that you are happy. I really wish that you are free from pain. And on this channel, we talk about women's health, whatever will make us feel healthy, whatever will make us feel happy. If this is a content that you really like or something you would like to watch, please ensure that you subscribe to this channel, click the notification bell so that you'll be notified when we post new videos. And please, in case you find this video or you eventually find this particular video to be educative, interesting, and you want other people to learn, please remember to give this video a thumbs up. That is how you really boost my channel. Thank you very much. And please take good care of yourself. See you some other time, and bye-bye.